hear everyone.
And we're grateful that you are hearing us.
Yes.
Thank you for taking the time to stop and listen to us and our podcast. Carrie, you know that I am someone who I feel very strongly about mental health.
Yes.
The topic is very important to me. I'm very open about it. And today I actually interview a therapist, but before I get to that, you and I are both pretty open about mental health.
Definitely.
We both have done podcasts that you guys can take a listen to. I did one about anxiety. Carrie did one about depression, because so many people out there go through these things.
It's so many people, and a lot of the times we don't talk about it, and that's okay. You know, if you're not open to talking about your struggles, that's totally fine.
Yeah.
I think it also helps to listen to others, because for some reason you feel so alone. You know that there are so many people that struggle with anxiety and depression, but in a way you feel alone. You think it's just you, right?
Yeah, absolutely. And there's anxiety and depression, and there's other things that people go through. And so really, I remember a few years ago when I was starting to go to therapy, I thought it was so taboo. I thought, oh, there's something so wrong with me. I'm going to see a therapist. And I'm so grateful that I got rid of that mindset and realized, no, therapy is literally for everyone if you want to feel better and work on yourself and your life.
Oh my gosh, it has changed my life. I see therapists weekly. If there are some weeks that I can't get to it, I do have a 6-year-old daughter, so sometimes, priorities change. Yeah. But I try to see my therapist weekly, and I can't tell you how much it helps just to be able to talk to someone that, whatever's on the top of your mind. Maybe something happened that day. Maybe it's something deeper that you want to have them help you with. These are trained professionals to help you with your problems and the way you see it. And it's a game changer.
It absolutely is. And I sit down with a therapist, Christy Kobe, and we talk about just general therapy. We talk about, why people go to therapy, what you should be learning in therapy, how to get the most out of it, how to find a good therapist. And it's just a really good podcast if you've ever considered going to a therapist, if you're wondering if you're getting the most out of it. It really is great. She breaks it all. I find this topic to be so important. I am talking to Christy Kobe, who is a therapist. Christy, thank you so much for joining us.
Oh, thanks for having me. I appreciate being invited to be interviewed, and I'm really excited for this conversation, Elora.
Anytime there's a mental health topic, I am so excited to talk about it, because I feel like for years and years, and even some people now find therapy and mental health such a taboo topic. But we are talking about therapy today, general therapy, how to find a therapist. We're talking about all the good stuff. So let's start off with, Christy, what are some signs that it's time to seek out a therapist?
That's a really good question. There are lots of different reasons that it could be helpful, lots of different things it could be helpful with, but generally speaking, when something emotional, mental, or in relationships is negatively impacting your ability to function, whether that's at work or at home, school, or in a relationship, it would be a good idea to seek out the assistance of a therapist. And that could look like when you feel like so much anxiety that it's difficult for you to be effective as a parent or focus at work, or maybe stress from one area of your life is really bleeding over into another area and preventing you from being present or effective in that other area. Or maybe you find yourself getting so upset by things that you're not able to complete your responsibilities. So in cases like that, you can really
absolutely.
Some experienced professional guidance can really help you kind of navigate that more effectively.
Absolutely. And it's not something that people should be ashamed of. And speaking of that, who is
Oh,
therapy for?
Really, therapy is most effective for people who want to create change within themselves and their lives. People who are willing to put forth effort and the time that's required to do those things. And it's more likely to be effective for people who are open to the process of exploring things with a therapist and committed to put forth the effort to implement those changes in between sessions. Really, the last 3.5 years hasn't taught us anything. It's for people who want to be more aware of and take care of their mental health and relational health, which are every bit as important as being intentional with our physical health.
Absolutely. There is a post that I post on Instagram every once in a while, and it's a picture of a brain, and there's a right side and a left side, and at the very top of it, it says, remember that your mental health is just as important as your physical health, because it is. It bleeds into so many aspects of our life. And I know for me personally, I'm just being very frank, I go to a therapist for my anxiety, and it's something that I need, and I'm really open about it. And so that's what I go to therapy for. What kinds of things do other people go to therapy for?
There's a wide variety of reasons you might seek therapy, but maybe you're a perfectionist, or you have tendencies to be a perfectionist, or maybe you tend to be a people pleaser, or therapy can be really helpful to figure out how to parent your kids in healthier ways than the ways that you were raised, or to gain a better understanding of why you're feeling so anxious and what you can do about it. So there's lots of different skills that you can develop for just managing things more effectively, managing your stress or things that you're going through.
And that is one of the things when I go to therapy, oftentimes people will talk to me and they think it's easy. And for me, I'm like, no, I go so I can have tools that I can actually use to change things. Because people will be like, oh, you just go in and you say this, this, and this. I'm like, no, I'm going in to get tools so I can change.
Absolutely. It's work.
It is work. It is work, but it's so important.
Good work.
Yes.
Yeah. So worth it, but it is work. It's not like you just come in and the therapist does all the work and you're like, I'm healed.
No, you have to put in so much work. And there are things, like I said, that I take a notebook with me when I go to therapy. That's not everyone's vibe, but that's my thing. That. So I take a notebook and I write down certain things that hit me, or I write down certain things that she gives me to work on during the week. So speaking of that, what is the goal of therapy? I knew what my goal was. What is the goal of therapy, and what kind of skills can we learn if we try and put forth that work when we go?
Okay, those are great questions as well. Usually there are multiple goals of therapy, and that's going to depend on the issues that you're seeking help with, what your desired outcomes for the process are, and also the therapeutic approach that's being used by your therapist to address those issues that the two of you have identified and kind of fleshed out together. So if you're seeking therapy for anxiety, your goals might include working with your therapist to identify the things that are triggering your anxiety and resolving the cause of those things to the extent possible. And then developing healthy skills for coping with those things that we can't resolve, because as you know, I'm sure all too well, there's plenty of things in our environment or in our relationships that we can't control or do anything about, or that are not certain.
My anxiety loves it.
Your anxiety is like, oh, I'm on fire. Going to a 10 today.
Basically.
Yeah. And then there's other types of therapy, like for trauma, on the other hand. If you're seeking therapy for trauma, it's more about making connections between what's happening in the present and what happened to you in the past. So the goals of trauma therapy are going to involve integrating the fragments of what's getting triggered from your past, emotionally, mentally, and in your body and nervous system, so that these trauma buttons don't get pushed nearly as frequently or intensely. And so the effects of being triggered don't last as long.
Right. So lots of different goals, lots of different skills. So this next question, and I've just been giving lots of personal examples with this, but I remember the first time I went to therapy, I'm going to be honest with you, Christy, I didn't know what to expect. I had no idea because
Yeah.
this was back during a time, like I said, several years ago, where seeing a therapist, going to therapy, it was so taboo. And I've used that phrase before, like
Mm-hmm.
we didn't talk about it. And I was almost embarrassed and I was so afraid because I thought I was going into this room where I was going to tell this person that I didn't know yet about my anxiety and about my perfectionist
Yeah.
habits, and I was so scared, and I wish I had
Mm-hmm.
known back then what to expect. So for someone who like
Yeah.
me is they're like, I'm ready to go to therapy. I have some things I want to work on. I want to do the work, but
Mm-hmm.
they're just scared because they don't know what to expect. What would you tell
Yeah.
them?
Oh, that is maybe the most important question of all the questions, honestly, because it really is so vulnerable and it's, kind of taking a leap of faith, or it takes a lot of courage to reach out and be willing to try this. I think to answer that question, it helps to say a little bit more about what therapy is.
Mm-hmm.
And of course, defining it can be really challenging because there's so many different approaches to therapy
Right.
and there's so many different therapists and clients. So there's no two therapy sessions that are going to look exactly the same.
Oh, yeah.
So, but in a nutshell, I would say therapy is this collaborative process of working with a licensed therapist to gain a deeper understanding of yourself, others, and your environment, as well as developing skills to enable you to have a healthier and more meaningful and fulfilling life, work, and relationships. And part of that process can involve healing old emotional and mental and relational wounds so that they're no longer holding you back. And so then in therapy, from my perspective, you can expect is that your therapist is going to ask you a lot of questions.
Yes.
And it's not to be intrusive or anything. It's to be able to understand your history and the relationships that have shaped who you are and your current situation. And it also has the benefit of helping you to unpack things as she asks questions, to see things more clearly on a deeper level, and maybe even from some different perspectives.
Absolutely.
It's totally normal, too, that you're going to feel a wide range of feelings.
Yeah.
That's one of the things that people are like,
Yep.
I don't like to feel feelings, so maybe I don't want to do therapy, but that's actually super beneficial to work through those rather than getting stuck in the feelings or overwhelmed by your feelings. And you're likely going to work on some new skills and tools in between sessions that you've practiced in session, because coming and talking about things is only part of the solution, as you know, and doing things differently in between sessions is also a key part of making changes in your life and your relationships and your environment.
Absolutely. Like we talked about earlier, it's not just you don't go in and you're done. You go in and you learn skills to take you through the rest of your life. Like you went in there,
right?
You went in there for a reason, to get help for something. And I mean, I think we'd all like to say it's this magic pill where you go in and sit down for 45 minutes to an hour and you're like, well, I'm good. But that's not exactly how it is. And on that topic, what kind of mindset should we have going into therapy?
Well, like you're saying, as with anything that's genuinely rewarding and meaningful, there is no shortcut or quick fix. There's no magical pill. I'm not going to give you a magic wand.
I mean, that would be crazy. That would be a whole other topic.
Yeah, for sure. People would love that. And I mean, it would be nice if we could just take a pill to solve all of our problems, or we could just give everybody a magic wand.
Yeah.
They're better. But really, it helps to come into this process with a growth mindset, meaning that you believe in the fact and the research validated reality that your abilities and skills can actually be developed through commitment and hard work, that you're not just the way you are and that there's no hope and that you can't change, but really we can change our most basic abilities through commitment and hard work. And I think it's especially important to keep in mind that genuine healing and change and progress in the things that you want to be different in your life is going to require significant effort and time invested into the therapy process. So if you have decades worth of experiences and relationships that are feeding into your current struggles, which, to be honest, most of us do, know that you're not going to be able to work through decades of stuff in just a few months of therapy sessions. It's going to take more than that to unpack
Absolutely.
and work through it all effectively if you really want to have long-term change.
Absolutely. But you said this word that I'm going to repeat. You said there is hope. So even if you have to go to a therapist longer than you think you will at first, there is hope. And that's one of the things why I kept going back, is because I got hope from an expert that, oh, you don't have to be this anxious all the time. Or if you are, here are some tools. And having that hope to make me feel better, to make me feel better in life, that hope is something that is so powerful that you and your therapist work on. That is truly, that is something that I would just tell to everyone. I'm like, if you're wondering about therapy, there is a hope that you receive in your sessions that is unreal. And that is one of the reasons I kept going back.
Oh, for sure. Because all good therapists are realistic optimists.
Yes.
And if you're, good therapists have worked with thousands and thousands of people like you, similar to you, struggling with things similar to you, and have been, successful in helping them overcome those things, work through those things.
Yeah.
It's so much easier than trying to navigate it all on your own.
Absolutely. And like I said, we've said this many, many times, there is hope if you are willing to put the work in. And we've talked a little bit about these things here and there throughout this interview. But what do you think is the most common misconception about therapy that you'd like to address? That you're like, all right, everyone, you're thinking this about therapy. We need to end this now. This is not a thing. What is that?
Probably one of the most common misconceptions about therapy is that therapy is only for people who are in this extreme state of distress or crisis. When, in reality, therapy will be much more effective and much less time-consuming and expensive if you start it before you're in crisis.
Right.
And before you're at that extreme level of distress, and by starting therapy when things are less severe, you can avoid getting to the point of being in crisis. You can avoid getting to the point where you needed a therapist yesterday and you don't even know where to start looking. And it's just so helpful to do it before it gets up to that point. And it's for everybody.
Yeah. And I've talked to some people who I've talked to them about therapy. I get now lots of people are like, oh my gosh, you have anxiety, but you do what you do. And I do podcasts. I speak in front of people and I do TV, and I'm like, A, I love it, and B, I have a really great therapist who gives me tools to handle my anxiety. So I've had lots of people, and I hate this phrase, but I have had people say to me, well, therapy is for crazy people, or therapy is for people who ... And I'm like, A, don't like that phrase.
Yes.
We don't love that. We don't like the word crazy. B, it really is, like you said, for everyone, because I think everyone out there in our core innately just wants to be happier and live a better life. And if you want those two things, then therapy is for you.
Right. I hate that word too. And I hate that whole, we're not allowed to say that in our
If someone says the word crazy, I'm like, no. That's not in our vocabulary. That's not how we explain people.
Exactly.
Therapy is for everyone. So we've talked about those common misconceptions. What is the most common problem you see with patients that maybe hinder them from learning in therapy, or, hinder them from seeing progress?
Probably the most common thing that I see is clients not being able to create momentum and significant change and progress because they're not meeting frequently enough for long enough sessions and for a long enough period of time with their therapist before they end their therapy. Because we're creatures of habit, and usually not the good ones, usually the negative habits, usually the reactive ones.
You mean the ones where I'm eating, my chocolate at 11 o'clock at night because I want a snack, but now it's become a habit?
Yeah, the emotional eating, just the reactive, the survival, the self-soothing or distracting types of habits instead of the good habits. Change is hard, and we tend to be negative and survival oriented. So in order to create that kind of therapeutic momentum and significant change and progress with my clients, I use 80-minute sessions with all of my clients, because those longer sessions are the gold standard for resolving things like trauma and relationship issues.
Mm-hmm.
And 80-minute sessions really allow us to identify and explore what's going on beneath the surface, so that we can address those underlying causes, which can lead to genuine healing and that lasting long-term change that people are seeking.
Yeah.
And I ask that people who want to work with me, like, oh, sorry, cut you off.
Oh, no, you're good.
To like once every 2 weeks at a minimum, because otherwise you just don't create that momentum and you're emotionally eating at 11 o'clock at night instead of like getting the change that you're really seeking. And you can say you're seeking it, but if you don't have kind of this length and the frequency, and I recommend at least 6 sessions before pausing things, it's going to be really, really hard and unlikely that you're going to change in the ways that you want to and create the momentum and progress.
Absolutely. I think, I'm sure that is a common problem with people who are like, well, you know what? I went to a 50-minute session, then I went and saw my therapist again 2 months later, and then I saw him again 4 months later, and I'm just not seeing any progress, so I'm just going to cut it. And it's like, well, like you're saying, that's not going to give you, you know, the results you're looking for.
No, it's kind of like you think, oh, well, I went to the gym in January, so why didn't I reach my goals for fitness and weight loss and things? Like, well, you went once, or you went once a month, and that was great.
Yeah.
Maybe you hurt a few days after that, and you remembered muscles that you forgot you had.
We've all been there.
Yeah, but it's not going to get you to where you want if you're not making it a practice, and if it's not something that you have kind of a rhythm going.
Yeah, absolutely. And sometimes, like you said, we're just creatures of habit. Like I mentioned a bad habit that I had that I now like go to therapy for. It had to do with my anxiety, and it's almost like we have to create new habits, a new way of thinking, so we don't slip back. And it's so easy to slip back if you see your therapist once a blue moon.
Right, for sure. And those old habits or patterns of behavior are like these well-oiled, greased tracks that you just can slip down in your sleep with your eyes closed backwards. Yeah. Whereas these new habits are like, sometimes it's like, oh, well, I have to dig a tunnel, and maybe you feel like you only have a spoon or a little spade to dig this new tunnel, right? So.
Absolutely. I have been there. I know that feeling. Digging a tunnel with a spoon is a great way to put it.
Yeah.
So for the people who are going to therapy, they're currently in therapy, what tips do you have for them to get the most out of it? We talked about seeing your therapist frequently and for a good amount of time. What other tips do you have for people who are in therapy right now?
So generally, the more that you're willing to invest of yourself in the therapy process, the more you're going to get out of it. That just in any way that you're investing yourself in the therapy process, that means being open with your therapist in session and sharing things so that he or she has an accurate and complete picture of the things from which to assess your situation and make recommendations, which they can better do based on a full and complete accurate picture of things. Also, taking an active role in the process means avoiding any mind-altering substances like alcohol or non-prescription drugs in the day or two before therapy sessions. Because you're going to get more out of the process. You're going to be able to participate more fully. Your mind will be more clear, and you'll be able to retain information better in that state. Yeah. I also am a huge fan of what you already talked about having a journal or a notebook. I recommend that all of my clients either have a journal or a notebook that they bring to session to record their insights from the sessions and like the goals that they're going to work on in between sessions, and notes of things that come up between sessions that they would like to discuss at the next appointment, because you think that you're going to remember what triggered you 11 days ago.
Yeah, that's why I started bringing a journal, because there'd be a couple times where my therapist would say something and it was like a light bulb went off, and then I was so in the moment and so shocked that 2 days later, I was like, what is that she said? And it's
Yes.
gone.
Right. We have so many things that we're trying to keep in our memory, and we just have limited capacity to retain all that. And it's just so helpful, especially if you have anxiety or, you're adulting.
Adulting is hard for everyone.
Yes. I mean, there's so many different areas of our life that we want to be present and effective in. It really helps you to either have a journal or a notebook, or have a place that is a dedicated place, like your notes folder on your smartphone or something, just regardless of the format, that really enables you to stay on track and concretely view like how much progress you've made through the therapy process. When you like read back on where you were, when you first started, it can be just so helpful. And writing down those things that trigger you in between sessions is so helpful to the process and to your therapist, because then you can really explore it. If all you can remember is, I remember they said something that really upset me and I was standing by my dining room table.
Yeah.
That isn't necessarily
helps.
helpful enough context to be as effective in working through that.
Yes. Well, and it's like you said, when you keep those notes and you go back, it's so nice to think to yourself, look how far I've come. Like when I came, I could never imagine myself being so calm about this situation, or I was so depressed when I came, and now I can handle things so much better. And it's almost like a pat on your back for yourself for how much work you've done, and to see that.
Right.
It's so helpful.
Yes, for sure.
It's one of the reasons I like it.
Yes, and it gives you hope. It helps sustain that hope that your therapist hopefully holds, but also helps you to have more of that hope yourself. Like, I can do these hard things, and I have done hard things already. Absolutely. And it's working.
I love that. So how can you tell? So we've talked about skills that we learn in therapy. We've talked about how to get the most out of therapy. How can you tell if your therapist is a good fit for you, if you're with the right therapist?
Okay. That's kind of an involved question, so I'm going to kind of flesh that out a little, unpack it a little bit. So whether a therapist is a good fit for you, of course, could entail a lot of different things, kind of depending on what you're looking for in a therapist and from the therapy process itself. Generally speaking, though, I would say a therapist is a good fit for you if you feel like you can trust your therapist and you can speak freely without fear of judgment from them. It's really important that you feel heard and seen and supported and emotionally safe with your therapist. In a good working relationship with them, you're also going to feel a sense of connection with them. Yeah. Feel like they care for you and your well-being, which is important for you to put your trust in this process and in this person that's giving you guidance. That person, that you choose to work with, if they're a good fit for you, they'll be mentally present and attentive and responsive to the things you say. And they're going to take an active role in the session, which usually means they're going to do more than just listening and nodding their head is kind of the quintessential stereotypical therapist.
And how does that make you feel?
Yeah. There's going to be more questions than that. There's going to be more movement from your therapist, like asking questions to kind of slow things down and explore something in more depth, or maybe they're going to explore potential solutions with you, or they might gently challenge you about a thought that you're having that, doesn't seem to really be supported by things in your life, that really you're worthless, and what leads you to believe that, or where does that come from? And so they're also going to demonstrate, regardless of what you choose, that they respect your self-determination, meaning that they respect your authority and autonomy to decide what you think and feels best for you, as long as you're not endangering yourself or other people, because it's your life.
Absolutely. And
you're the one that has to live with the consequences of what you do or don't do. And they don't. So they're just there to hold space for you and offer expertise. Whereas your neighbors or your family, your friends, they might be like, did you try this? This is really important. And I really want you to go to this, thing that helps me.
Yeah.
And that might not be the best thing for you.
Absolutely.
So, but the research really shows that relationship is so important. Oh, sorry, I cut you off.
Oh, no, you're good. You're good. I was just saying that is so helpful. And all of those things are so important in a therapist. And you have spent the last we've been here for about 30 minutes giving us such good information for those of us who maybe are seeing a therapist, who aren't getting the most out of it and what to do, and those who are possibly seeking to go to a therapist. Christy, I want to thank you so much for being with us today.
Oh, you're so welcome.
And the time you have spent. And for everyone listening, thank